Amazing. See, I told you he was going to be everything. Oh my God, worth the wait.
Oh, I'm so happy. Oh yeah. Let me have it. Okay. Let me have it. There we go. There it is. Nice. Very nice. I know. Thought I wasn't going to get it. Sorry. Greedy chiropractor. I think you missed one, Ed. Why is it inflamed? Maybe it's inflamed because it keeps getting punched. And I have this crazy notion that if you stop punching it, it'll stop being inflamed. If I get decked in the face, my face swells up. The only way for my face to not be swollen is to stop being decked in the face. You don't get to decide. Your spine's a volunteer structure. It's not under conscious control. I can't say, Adam, start bending in your middle back.
Yeah.
That's not how it works. It has to it either volunteers or it doesn't volunteer. And I'm going to make it volunteer.
Cool.
Yeah, a lot of lower back pain. It's I've trained in dance, so it has been kind of an ongoing issue throughout my adult life. And some of it comes from twerking and kind of like club dance movements. And usually after that, it's pretty severe and it's almost debilitating.
Muscles get all tight down there?
Super tight. I think it's the muscles are overdeveloped in my lower back. So that's the main zone. It is definitely like kind of up and down my spine, but the lower back is definitely the worst.
Has it gone down your legs? Have you felt pain shoot down the leg?
I have. It's not always, but it's mostly zoned in here.
Okay.
I have noticed some tingling in the fingers.
How long has that been going on?
Not too, like 6 months or so, off and on.
When you're dealing with tingling in your hands, we're dealing with the wires that leave your lower neck. The nerves most likely get pressure on them from the disc, and I'm going to just use the lower back because it's easier to see, but the disc can come out and hit the nerve, and that's what then gives you sensation down into your hand. Same thing in the lower back. The nerves that leave your lower back go down the lower back. Now, the local pain in the spine is usually the joint, so when you're doing dancing and movement, if all the movement's happening down here, we're going to overstress the joint.
Right.
And then the muscles get tight to protect. A lot of what I do is balancing the spine, like balancing a tire on a car.
Right.
If this part of your back up here is too tight, then that's what allows this to be doing too much. So we have to, I almost ask an inverted question. I ask, why are we not hurting in the other parts of your spine? Not so much the question, well, doc, why am I hurting so much down here? That's probably just abused. It's just overworked.
Right.
We have to make your spine limber and supple, and then I'm going to show you at the end of the visit some things we can do long-term and things you can do at home to get your spine in a better position. Can I ask how old you are?
46.
So you're 46 years old. I expect to see a 46-year-old spine, and that's perfectly fine. But we don't want to see accelerated aging.
This zone right here.
So quadratus lumborum, see, go stay up straight for me. Relax your back. Even upright, he's just got there's a static tension in your back. Your body's in guard mode a little bit. Your back, Adam, should feel soft.
Yeah.
Right?
The lower back.
Like right now, your back just feels like
muscled.
It's in guard mode. Part of that is good. Part of it is your body protecting something that has happened. And the only way for that to go away is for it not to need to be guarded.
Right.
Right? As I bend forward, watch. See how the back gets tense?
Yeah.
So posture creates tension. As I come upright, it can relax again.
When you bend forward like that,
Yes.
if I do that, I can actually crack my back just by going forward, and it alleviates it though.
Right, so cracking will release some of the tension in the joint. The problem is you're so loose down there. So if you keep cracking it, the joints get more and more mobile, get more and more inflamed after you've done doing it. It's why people, when they pop their own spine by rotating, they're only popping the loose ones. So you're not loosening what's tight, and so what's loose gets looser, and what's tight remains tight, and so the disparity between the tight and loose areas grows. You've got to be careful with that. 2 ways I'm going to help you. 1, you won't feel the need to do that,
right.
And 2, you won't be able to because your middle back's going to be working as a team. Have this arm under and over. All right, take a deep breath in for me. And exhale. There we go. Deep breath in. Here we go. Let it go. Exhale. All right, deep breath in. One more. Exhale. Chin down. Got a little tight there. We'll get them. You did good. So the goal of this adjustment is to try to loosen up the sacroiliac joint. You remember how that back's supposed to have a curve in it? Just in case you go to another chiropractor and they bring your knee up real high, maybe you're used to this, that's not good because that flattens out the lower back. I want the curve. Just say, this guy in Sarasota said this, he kept on saying lordosis over and over again. The curve is so important for the longevity of your spine. So when I adjust you, I want you to have some semblance of that arch in your back. Breathe in deep. Exhale. Okay, yeah. Here we go. It's okay. Other side for me. Exhale. But it's okay. Face up for me. It's okay. Here we go. Real gentle. Just try to move this top guy a little bit. Here we go. Here we go. There you go. Perfect. You okay?
I'm puttying your hand.
You're doing good. Let that go. There you go. Let it go. There you go. Good. Okay, we'll get it. All right, my friend. The more forward your head goes, it actually places more leverage on your lower back. So the alignment of your head to shoulders, and the more forward your head goes, the tighter your middle back becomes. So the alignment of your head to shoulders isn't independent of your lower back. It increases leverage on the lower back. So getting your head curved and your head back, this is where phones and life and looking down all the time aids and abets.
That makes sense.
Stress on your lower back. So it isn't.
I've been looking at a computer the past couple of years.
Right.
Because the lockdown isolation was
intense.
Yeah.
Yeah, it's just, and that puts us in a position where our spine essentially is on a skeleton crew. Only 5 vertebrae are doing 99% of the work, and so that skeleton crew now gets overstressed and says that it's had enough. And so the fix is real simple. We just got to tell your spine, tell the rest of the spine to wake up, and just get it moving again. Yeah. I use the massage as a coercion, as a way to try to further loosen the joints. I adjust sometimes cold to see how your spine was working before it was warmed up. Somebody might say to me, Ed, I adjust much better if you massage me first, and I'd say, it shouldn't require a 10-minute massage to get your bones working. There we go. They found within 10 days of a joint not moving that it starts to become frozen. So these joints up here can get tight pretty quick. It's not like it's a... You had an auto accident years ago, I said there?
18, so it was a long time ago. Luckily, it was a pretty severe accident, but we hit backwards, so we had pretty good seats. So the impact was absorbed into the seats.
I gotcha.
Or else it would have been probably fatal.
Oh my gosh.
We rolled the car 10 times.
What?
On Christmas Day.
Oh my gosh. Merry Christmas, right?
Yeah.
Oh my. Was it up in upstate weather?
It was California. I'm from California.
Okay,
so
I gotcha.
It was like Santa Cruz Mountains area.
Gotcha. Oh my. Here we go. These are the roots of your neck. The roots elevate because as the head angles forward, these rise up. They're really not. I've had different therapists and chiropractors ask me, what do I think about trigger point therapy? And the answer is trigger points shouldn't exist. They exist because of aberrant posture. The more forward your head goes, the tighter these traps become. And so if you get the head back, the tight traps will go away, right? I don't treat trigger points, I treat posture, and then therefore tight muscles go away. And then as we take the stress off the injured joints, they won't need to be guarded. So sometimes you can have tight muscles from posture, sometimes the muscles are tight because of guarding. This is a big reason why I work on people laying down, because I take posture and gravity out of the equation. Then the only things that are tight are just the protection. That's going to be with you whether you're upright or laying down. There we go. Most of life's tasks look down more than we look up, and so
Maybe if we put our computers up.
Yeah, it helps if you can. Just fasting. I call it like diet.
Right.
First way is to fast from all the sugar. It's like fasting from looking down if you can. It just limiting it as best we can. It is a tough battle. There it is. Nice. Very nice. I know. Thought I wasn't going to get it. Sorry. Greedy chiropractor. I think you missed one, Ed. There we
Yeah.
Yes. Oh, you have chapstick on there?
I couldn't find it, so I'm stealing some of this.
Oh, yeah.
Oh, wait, no, I
Okay.
have to get that on video.
My lips are a little chapped and I lost my chapstick.
There you go.
Multi-purpose.
There we go.
It's good for that. That's how I'll be patient use.
What are you doing? You're just drinking the bottle. These are the roots right here. Just trying to open up these channels. So the nerves that go down, they mentioned the arm symptoms, we have to get, so the stress off your lower neck. We want to get your upper neck working as best as possible, the upper back moving as much as possible. And then as the stress goes off your lower neck. So which fingers were it
It's
specifically?
kind of the outside too.
Okay, so this would be C8, C7 is here, but these two fingers are specifically C8 nerve, so which would be right at the bottom of your lower neck.
Yeah. I feel a little in the middle too, but it
C7.
seems to be the...
So each nerve that comes out of our spine goes to a specific part of our skin. We call this a dermatome. The dermatome is a specific, so many times there's overlap, for instance, so your bicep has some overlap in neurology, your tricep, there's one main nerve, but then there's a little bit of accessory nerve that goes to the muscle. But with the skin, only one nerve goes to each section. So this is called C6, called the 6-shooter. So if you have numbness in your thumb and index, this is C6. C7 is your middle finger. C8 is your ring and pinky finger. So when you have symptoms in an area, this is where an MRI would usually correlate that, and you could say, yep, we could see the pressure on the MRI. So this right here is where this is what we call the thoracic outlet, or the funnel that the nerves that leave your lower neck go down into your arm through this channel. Can't have any soreness in this channel. So when I rub here, Ed, it's a little touchy, there shouldn't be anything. You should be able to, Ed, is that all you got? There shouldn't be any tenderness, in there. So this is the gua sha, a little comb with a smooth edge, and this is a way we can use to draw blood into these areas. Now real quick, a mark came out right in this channel. So the road that the nerves travel through to get to your arm has some construction on it. This is the channel that the nerves traveled to go into his hand. So the nerves exit at every level. The disc can hit the nerve here, but then it also can get irritated as it's traveling down the road. It'd be great if you go down, if you go to the beach. If you get in the salt water today, or if not, I'm just saying salt water is one of the best treatments for this, because it pulls it right through the skin if you can.
We went to the beach yesterday, but we didn't get in the water.
Is it still cold?
No, we just kind of got there late.
Okay.
We're planning on going up to this.
5-6 swipes and it comes out pretty dark real
Yeah.
quick. The mark is never normal. It signifies acidity, lactic acid, inflammation, nerve irritants. It's a component, it's a percentage of why you have symptoms in your hands, is this right here.
Mm-hmm.
Some percentage is the disc. Again, without an MRI or picture, I don't have any. Give me, what do you think it is? I don't know. I have to take a picture to see what percentages are, but this is definitely a significant portion of it, is just this inflammation in the road.
And this relieves it?
Well, this will draw blood in here to bring oxygen into it, to bind to the acidity, to wash it out of the tissue.
Right.
So we can't have it trapped in here. When it gets so tight, when a muscle's tight, it cuts off its own circulation, which doesn't allow the tissue to wash itself.
Got it.
Okay?
So the blood comes and heals
Blood
it by
comes in.
flushing it out.
You got it. You got it. Here. Yeah. No, it's. Which leg? Do you feel it go down your left leg more than your right?
Not really.
Kind of just mainly lower back.
Yeah.
Okay, this right side is way more overdeveloped. This is nice and smooth over here, and then oh my goodness.
I did springboard diving, which is sort of a one-legged hike, so it is asymmetrically built up.
I'm just wondering.
But I don't notice a pain difference.
I mean, this left side of your back is nice and soft. There's a couple little bumps, but it's not elevated. The right side of your back from here is at least a 1/4 inch higher
Wow.
than your left, and it's tighter. It's much tighter on your right here. So it's asymmetrical and it's tight. So that's kind of if it was symmetrically tight, at least it's symmetrical, right?
Yeah.
But it's not even symmetrically tight. You have one side that's overdeveloped and it's tighter. Just breathe through it. Try to let it back to sink into the table. biomechanically, this part of your back up here is supposed to work before your lower back. So it really shouldn't be possible with normal mechanics to have this overstressed without this first being overstressed. All right. Yeah, right there. That is the most responsible right here for your pain. Right there is the public enemy number one. There.
Usually what I feel is lower than that.
I understand. This is the cause.
That's the cause.
Cause
okay.
and effect.
Yeah.
Problem is up here, and then the abuse. I understand the
Yeah.
abuse is down here. I get it, but I can't help a sprained ankle by further
Right.
spraining it. It's just simply being overtaxed. Yeah, it's gonna get real bad. Right there. Just when you go to the beach, people are gonna go,
Oh,
"What the?" I think he has shingles. You do not have shingles, okay? Just to preface this, okay?
Okay.
I've had patients improperly diagnosed with this. This is gua sha. Your shingles will be cured in 2 days when your marcus goes away.
We'll just go in the water.
Correct. But
Yeah, we haven't seen this. We've seen the cupping a lot on the beaches, and we give that
Okay.
a look.
similar type of, okay,
Yeah.
same kind of, but this is gonna be a little bit more. The cupping's fine, but it misses sections, right? You're only getting
Right.
where the
Right.
cup is.
Mhm.
Which is fine. Then you gotta take them off and then put them on in the places that you missed. But if you can handle the gua sha, it gets the whole tissue better. And
Yeah, it looks like it does.
I just find that it doesn't miss anything like the cupping, which it's a little more intense. Cupping's a little more gentle, which might be why it's done more frequently. But I find that this is the most. Yeah, there's just one here. There's one lump right there. Feel that guy?
Mhm.
Right there, and then. But overall, this is not nearly as elevated and tight, but there are little lumps in here. Right there, wow, yeah. You were waiting for this, man. Ooh,
Mhm.
yeah. Waiting for this.
I've made him watch some of it. I can just watch it, like some of them. I'm like, oh my god,
Please,
this is what I need.
Here, lay on this table and
I know, so I went to the other guy, I was like, we're not staying there. This is not even close to. Yeah, I could go get a massage chair at the airport for this.
I'm so sorry. It's embarrassing.
Yeah, he's been talking about you for so long. And he was even comparing the chiropractor that we saw before this
Aw.
to you.
I was telling him what you do, he's like, well, yeah, I don't do that. I'm like, okay.
The bar's been set too high. Nothing else matters anymore. No. It's awesome. My dad was always hurt by care that focused only on the areas that hurt,
Mm.
because it kept on manipulating and loosening and popping what was already injured. And it feels good temporarily, 100%. My dad, popping this, I get it. You'll relieve some of the pressure, and it just comes back an hour or two later, and you get to pop it again, and you get to pop it again. And you just, so, I usually joke, some guys do a really good job like you know, if you overwork your muscles, they grow, right? I tried, anyway, but you overwork a muscle, it grows. You overwork your skin, you get a callus. If you overwork a joint, the joint will grow in the exact same way. A joint getting bigger in America is called a disease, degenerative joint disease, osteoarthritis, and my question then is, why don't we call muscles getting larger or skin getting thicker? And we call those hypertrophy, right? So to me, it is not a disease when a bone grows, it's an adaptation to stress. The first fallacy for 102 years, chiropractors taught that adjustments change posture. And that has to be thrown away. You have to let that one go, like Frozen, or like the curling people when they're curling, they're let it go. Is that really a sport? I don't know.
That's a strange one.
Yeah, let it go.
It's a strange one. If sweeping is a sport.
Yeah, right. Stretching is how your posture was made worse. Stretching is how it's fixed. The same way that you arrived is how you're going to leave. I have to prep you. This is all. Why are you spending so much time rubbing his back? I got to get his back moving better than it moved earlier. It moved it 50%, 60%. Aren't you happy? No, not happy. It needs to move way better than that. If you were 86, I'd say excellent. 40, no. Feel the desire because of the inflammation. As your spine is balanced, you won't feel that desire. And then you won't be able to because you're not going to get this to tension because the whole spine is going to work as a team. The only reason you can pop that is because this is so stiff.
He can pop, by bending down, he can do that one.
Correct, but that's because he's so mobile down there.
Right.
That's why it hurts. That's why it's so tight. So my point is that as his posture gets into a better position, as his middle back comes to the aid and rescue to his lower back, he's not going to feel the desire and it won't happen. That's, to me, the only way that's resolved. So there are many joints in the spine that haven't been moving, and when they actually haven't grown at all. They're younger than you are, and I don't mind if they grow a little bit in response to their lack of function. I would actually almost want them working extra to make up for all the 30 years they've been doing nothing. I want them to spend the next 30 years doing double. So let's talk to me after 20, 30 years of them doing double, and then let's see what happens. But if we don't stop the abuse of the older parts of your spine, you feel as old as the oldest part of your back. So if you're 40 years old and there's a part of your back that looks 70, you're going to feel 70. Right? That's how people think, I feel like I have an old back. Especially if that 70-year-old part's the only one that's moving. If you're as old as the average amount of your back that moves. So if you have the younger parts moving, that brings the average down. So you feel younger because you're chewing on the younger teeth. If you keep chewing on the old teeth in your mouth, every bite's going to hurt. Your spine's a volunteer structure. It's not under conscious control. I can't say, Adam, start bending in your middle back.
Yeah.
That's not how it works. It has to it either volunteers or it doesn't volunteer. And I'm going to make it volunteer. He's going to the front of the line.
Sign me up, coach.
It's going to be some passed out guy in the front line like, what, me first? Right? Yes, you're up. And the one that's injured, I'm putting him in the back of the line. He's going to be the last one that's called. Why is it inflamed? Maybe it's inflamed because it keeps getting punched. And I have this crazy notion that if you stop punching it, it'll stop being inflamed. If I get decked in the face, my face swells up. The only way for my face to not be swollen is to stop being decked in the face. Not just to keep injecting cortisone into my face.
Yeah.
Right? It's like the punching is what's causing the inflammation. And then they look at me and go, we're not sure if we believe in that. That's what I'm dealing with. We're not sure if we believe that not being punched in the face every day is going to make your face not swollen.
Seems pretty straightforward.
It's like crazy. That's crazy talk. Your lower back is the only part of your back that works. And rightfully so, it's not very happy about it. Mm-hmm. So let's pop it more. Let's crack it more. It's not the right approach. And there we go. Skin's fine, I promise, but we gotta get that out of there. All this tension you have. There you go. There you go. There we go. It's like my canvas.
Heart.
Just drawing on my canvas. You can't visualize this on a picture, so it doesn't exist. It's not something that is brought up in conversation. The bruising, the soreness along the spinal column that is irritating the nerves, causing symptoms, causing dysfunction, causing pain, guarding.
You're getting pretty qualitative at doing it now. Do different people get different variations of the bruising?
You got to know. I only draw out what's there. It's
Yeah.
like carpet cleaning. It's what brings nutrients in. I think of it like the water to a plant. You got to have water. You got to have sunlight. You got to have fertilizer. You got to have nutrients. But overall, if it was any component, you have to have the electricity. It's what powers the machinery, and that's your nervous system. It's why the first thing that forms when you're being built isn't your arteries, isn't your heart, isn't your leg. Your nervous system formed first, embryonically. And before you even formed a heart, the nerve to the heart had to form. The cardiopulmonary nerve is what made your heart. It's not the cardiopulmonary controls the heart. No, it's the cardiopulmonary nerve built your heart. You wouldn't have a heart. My point is that your nervous system is what controls everything.
Yeah,
and if the nerves are being impeded, then the tissue falls apart, the tissue atrophies. doesn't function properly. There's a nerve that goes to the muscle in the artery wall. So arteries, the blood flow is controlled by the nervous system. Circulation's important, but what controls circulation? The artery doesn't decide to increase blood flow to an area. The brain does. The nervous system does. Anyway, try to arch up for me. Put your elbows underneath you. If you can, see up like a cobra pose. Does that make sense? Yeah. If you can, you okay? See if you can. If it's too uncomfortable, you can lay back flat. But see if you can hang out here for a second. So we work on you in extension now. We actually bend you back and then further close.
Good.
Okay.
That feels even better.
Okay, yeah, that's
Amazing.
there we go.
See, I told you he was going to be everything. Oh my God, worth the wait.
Oh, I'm so happy. All right, 5 more seconds. Here we go. All right, go lay back flat for me. There we go. Rule number 1 of massaging people's back: don't whack the spine.
Yeah.
It's the first
I'll
year.
let you know if you lack a spine.
Patients will absolutely let you know.
Yeah, I can usually start in the middle and then go outwards, and sometimes it'll slip in a little.
I know. He's,
And he
yeah.
lets me know.
Yeah. You stay right in that little gutter. Stay right in the little channel, right next to the spinal column. Practice makes perfect. See, if the joint was stabilized, the muscles wouldn't be tight. The stability of the joint comes from posture. So the more forward you are, the more you destabilize the joint, the tighter the muscles become. So the more we can get that's why I worked on you last, a few minutes ago, arching up. That further closes the joints. Now the muscles don't need to be tight because they detect that the joints are more stabilized because the lordosis is back, because the curve is in your back. The loss of curve destabilizes you. And there we go. All right, that's what these hips do. So above and below, this is the below part. This is the SI joint. This joint was definitely reluctant on your side. Now, Ed, I think if you body slam me harder, you might have been able to get to it. I didn't want to body slam any harder because what can happen is this moves. Does that make sense?
Yeah.
It's not worth the chance of loosening this more if we bust this up, right? So I'd rather take it a little slower, be more focused in the adjustment. I want to just target that joint right here. This is responsible for your lower back being overstressed along with your middle back. They're both right there. Can't be any tenderness in here. He's tough, man. It's pretty good.
I can breathe through the pain.
You're
I
doing
know.
good. You're doing
I know the pain. The more it hurts, the better it feels.
You're doing good.
I popped a hamstring when I was dancing a lot, like 3 times. Pop, 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 and it got to the point where I couldn't drive a car.
Oh my.
I couldn't step on the gas pedal, and I found this guy who was a godsend. He was this 4-foot-tall blind Cambodian man. And he saw with his hands, and he was able to massage out this bust, like popped hamstring. It hurt like crazy, but it was such a endorphin releasing pain.
People ask me all the time why I have my eyes closed. You don't need them.
Oh, yeah. I
This guy
noticed that too. I was like, that makes so much sense to not see with your eyes,
That's right.
but see
Feel
with
it.
what you're feeling.
Yep. It takes the eyes out of the equation and you can actually visualize what you're working on. It's a distraction. It's sometimes right there.
I was just showing off in a class, and it was a pole dancing class. These girls, it was in LA. These girls had this pole dancing class, and I went in and I put my foot at the top of the pole and I just forced it up without stretching or anything, and it went pop, 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 and I was like, oh, great. Showing off was not a good idea.
Every time I've ever tried to show off, bad stuff happens.
Bad idea.
I know. Your mind said you could do it. But
Yeah. Body said, maybe you should warm up first.
All right. There we go. Good. Okay, all right.
Whoa.
You know, this your shoulders up there at the top, those marks.
Oh my God. So that's the tingling?
That's one of the pieces of what's causing your tingling in your hands. We got to get that cleaned out, get in the salt water if you can today, if possible.
Yeah, definitely can.
A lot of water today.
Watch this. Looked weird. Say, but
Your ear will stay on. Go ahead and tilt your head left for me a little bit.
Oh wait, I should tell you. I don't know if it. I had in that car accident. I have some scars on my forehead, and both my ears were ripped.
Okay.
So they were sewn back on. So I don't think that's the problem. But you see the scars.
Yes, I see them. Yep.
So I don't know if that's.
Maybe we'll just take it easy on the both ears.
Yeah, like I had T-tops, a 300Z exit had T-tops, and we rolled it. I felt the glass and the rock hitting me in the head.
Let me go real gentle. I'm just gonna do the top one here, real
Okay.
gentle here. I'm not gonna go too crazy. I got you, bud. Okay, I got you. A little bit. It's okay. It's okay. There's definitely some scar tissue back there.
Yeah, so there is scar tissue in my, and it was all superficial
Tilt your
damage.
head left. Yeah, that's it. It's okay. All right.
Yeah.
Look up for me a little bit, and then press back with your elbow here. It's okay. Check this side. All right, go ahead and press back here. There we go. Yeah.
Oh, wow.
Yeah. There we go. There we go. Okay. There we go. Good. Good. Okay. There we go. Yep, it moved. Nice. Nice and loose. Let's go over here. So with this, I want you practicing for the next month, working on arching back. So we're not going to go down to your lower back with this. We're going to end very similar to where my elbow was on your back.
Okay.
Kind of middle back, upper back. We're trying to create a new fold, a new bending point, and retain it with the stretching.
Okay.
So we start more broad, and then, over time we would become more specific. So they made looks like my elbow or my thumb,
Okay.
and it's much more pinpoint. I would be more comfortable just starting with a roller since I might not see you as frequently. So let's just start with a roller, rolling your middle back at the end of your day ideally, so you don't brush your teeth and eat a bowl of ice cream and then go to bed. You want, the last thing you do is put your spine in the right position. Every minute you're staying and then moving 1 inch. So go ahead and push with your feet and roll this way 1 inch and then stay. Get the idea?
Okay.
So every minute you're moving 1 inch up or down on your back. If you're going to go party, have a good time, you might want to just maybe not do 20 minutes on this, but just scan your back for a few minutes and just loosen up your back, like you're saying, warming yourself up. So you're warming up the middle back, the upper back, the parts of your spine that are young, to make sure that they're working so that when you go out, you got your whole spine working as a team. Okay? And that's it. You just, this is the rollers, the first kind of the beginning toothbrush. Let's try. I don't need to kick his butt on the first time you do it. There we go. Get the idea, right? You want to, but don't overwhelm yourself. Time is more important than depth. So don't go for the kill and then, I did 10 minutes, Ed. It would have been better if you did 20 minutes at an easier level than 10 minutes at a deeper level. It's more valuable. Why is that? Because ligaments take about 19 and a half minutes to fatigue. So if I asked you to stretch your hamstring, we could do it in a minute or two, right? We could stretch a muscle quickly, but we're not stretching muscles here. We're stretching rubber bands.
Right.
The rubber bands have a longer, call it ligamentous creep. They take longer to lengthen. Yep. It's good for hip health, getting your knees down, working on, we just don't, many things in life where our hips are internally rotate, they don't externally rotate. And so part of the hip socket is never really explored, and then gunk builds up in there. This is where tree pose, in yoga they do it, you're doing the same thing. You want to get that knee down
flat.
in tree pose.
Hips.
Look at you.
Oh, look at that.
Woo!
Oh, that's cool. Here,
Uh-oh.
yeah. I'm like,
I'm gonna split my pants.
Wait,
No,
yeah.
thank you.
Can you do that?
No way.
Get used to
Yeah,
it.
you'd probably split those.
I gotta film one more. Why would you adjust the entire person with your legs?
So Here, get behind him. Like, just, I don't know, act like you're bending.
Act like you're doing this.
Yeah. That's really good.
Very nice.
Usually hook one toe.
Good.
They just pull all sorts of stuff. That's cool. There you go. That's neat.
Yeah, very nice.
Very good.
Awesome. Pleasure.
Amazing. Thank
Awesome.
you
Thank you,
so
sir.
much.
Appreciate it. Thanks for dropping in. Yes.
You
Awesome,
got
guys.
him without touching the floor.
Yes.
Like levitated.
I do feel much lighter and happy as can be.
Good.
It was everything I expected. and
Awesome.
more.